Yeah.
I've got a dancing Jasmine. Okay, I'm here to answer some questions that you guys have been asking last night and this morning. Let's see how we go. I'm a bit nervous. I'm not used to being this side of the camera, especially since we've been here, so let's see how it goes when I find them. Oh, you're not even going to be able to see, are you, if I show you? Well, there's loads and loads and loads and loads and loads. Oh, and loads. Can immunosuppressants be used to bring TSW to a more tolerable state? I've seen people come out the other end not as bad as when they went on them. I didn't come out of Dupixent as bad as I went on them, so there's a few different variables in that. One would be time. I don't know, some people flare and come out worse, so I think the thing with immunosuppressants is, like, I'm unbiased because I used them and they helped me for a bit. I went on them when I was literally ready to end my life, and I needed that at the time. So if you're there and you feel that's what you need, then go for it. Do you get flare-ups only where you use steroids or other places as well? So yeah, I think that's why it makes it TSW, is because it's like you start to get eczema in places that you didn't have it before. And I've seen loads of people that didn't touch their face with steroids and their face is really badly affected by TSW, which is quite sad. I did, however, put quite a lot of steroids on my face. Why would a doctor just keep prescribing steroids? Shouldn't they be cautious of TSW? I like a controversial question, to be fair. Why would they keep prescribing steroids? One, because it's the first line of treatment. It's a guideline treatment which they have to follow. Two, because that is the only option apart from moisturisers that they have. Three is all the other options take too long or are expensive, like allergy testing, that kind of thing. It kind of takes too long to like figure out what's going on with someone's body. It's kind of it's an easy and quick option. Do they know about TSW? I've heard that they do. I've heard that some people don't. I think they all know that it thins the skin, it being topical steroids. Do they know the effects? Probably not to the extent. I think that's why we all need to share more about how it manifests in all of us, because it can look different. Next one, red sleeve tips, and does the redness take a long time to go down? The redness will take a long time to go down if you're still moisturising. This is my opinion and something I've seen many times, especially on myself. I stayed red the whole time I was moisturising, and the minute I stopped moisturising, I would kind of see, obviously it was really flaky, but I would see normal skin colour return. That would be my advice, is stop moisturising. I do think not moisturising with TSW is very important, and I can't stress it enough. But the only thing with having to stress that is it was probably the most horrible thing that I had to do. So it's like me saying, here, try this, it's going to help you, but it's also like horrifically like difficult and uncomfortable, and so I feel uncomfortable kind of suggesting it, recommending it, but it was the best thing that I did. One of these, it says, it's got a kiss and it says sex chat. XXX18.
Okay, this Q&A is taking a turn.
Yeah, I'll do that one later.
OnlyFans.
Oh my god, if I had
skin starts an OnlyFans.
If I had tits, I'd go on OnlyFans, to be fair. And is Singapore the only place to do regenerative laser for skin? No, I think that there'll be a few other places, but the place here is specific for skin conditions such as eczema, TSW, mainly TSW. I think they do some laser on acne patients as well. Are all regenerative laser treatments the same, like the one you've been getting? No, the regenerative laser, I keep saying this, but the actual laser I'm getting is called high pulse blue laser. So it's a blue laser and it's not dangerous at all. It's quite soft. Someone else in here had asked me how it works, and I'm really crap at trying to explain scientifically how it works, but let's try. So when I read up about it, it seems to like pulse through the first 2 top layers of skin and then like kind of rebounds off of the fat layer of skin underneath. So you think you've got 2 layers of skin and then you've got like a bit of a gap and then a fat layer, and then underneath the fat layer is your muscle. So it's just, rather than some lasers go through to the muscle, it's not going that far, and it's like pulsing and like re-energizing the damaged cells that have been damaged from steroids. I don't know what the fuck it's doing, but it's working, basically. Do you ever get cold sore breakouts on your face or lips with TSW, and what helped? I don't think I've ever had a cold sore in my life. My mum gets loads, so I kind of know what they look like. The only thing I did get, well, me and Jasmine have been getting, is the angular... What's it called?
I literally have no idea.
Angular...
Chest something.
Chestitis.
Angular cheilitis.
And we think that might be from fungal. We've both had horrible fungal infections out here. Okay, what's the budget to stay in Singapore for 1 month for the Skin Health Centre treatment? My rent is $850, and that's just for a room. I think that's about £450. And the treatment, it depends. I've kind of talked about this. That really does depend on how long you need and what body parts you're getting. Ballpark figure, I think mine, let me think, maybe it was like $1,000 a month, so it is expensive. So that's $1,000, $450, and then you're spending money. How did your boyfriend help you through TSW? So Brandon helped me through TSW by kind of being there when I needed him. He would literally go to work, get on a train, travel 20 or 30 minutes, come back to my mum and dad's, then get up early in the morning, go back to work, come back. The whole time I was off work. And he didn't really like expect too much out of me. He was just there. My mum was looking after me. Well, my mum and dad were looking after me. My mum used to be a nurse, so it was kind of made sense because I was so severely poorly that B couldn't look after me because because I was bedbound, you kind of need like a nurse. Like if I'd been in a hospital, I probably would have been in a hospital bed. So Brandon, I remember one night, I just got out the bath and I was really uncomfortable and I was moisturising at the time. And I just remember this moment of peace when he was like, lay down, I'll give you a massage. And he like, I want to say lubed me up with loads of moisturiser and gave me like the nicest massage, like full body massage. And it was just this moment of like utter peace in like a world of pain. And I'll never forget it. It was just really sweet. It wasn't sexual or anything. It was because you don't really have sex when you're going through TSW. Not how bad I was and other people. It was just lovely. And he also would stroke my hair for hours and hours. Those were the kind of, those touches that we could share. And I was really uncomfortable at night time. I was getting a panic. And it was just kind of reassuring and comforting to have someone stroking my hair for that long. And it must have ached his arm so much to do it, but he still did it every night. Yeah. Okay, how do you deal with reoccurring flares? Thanks, you're very inspiring. Thank you. How do you deal with reoccurring flares? This is one of the hardest things with TSW, and it can be completely soul destroying. To be honest, the first couple of, up to like 6 months of TSW, I was kind of in one flare. So everyone was talking about these flares and I was like, I don't get it. Like my skin's just been the same. It was just bad for 6 months. But then I did go to Vegas on a hen do, and the dry heat kind of like, it made my skin so much better. And then when I came back to England, I just had the same, like I had a massive flare and like everything was open and oozy. And that was kind of the one that broke me. So I would say the flares can be really soul destroying because the TSW does cycle around, so it can cycle around your time of the month, or it can be stress, alcohol, not sleeping enough, food allergies, that kind of thing. And it does, so you kind of feel like you're getting better and then you get worse again and then you're getting better. The only thing I would suggest in that is that the flares do get smaller every time and do get easier every time. So make sure that you're taking pictures so you can look back at your last flare and say, okay, this is shit right now, but it's not as bad as it was last time. And try and be reflective, but I do know that it's hard. Especially some people get anniversary flares. I mean, I shouldn't really say that. It's a phenomenon that we're not really sure about, which is like a year later. I think I'm not sure why that happens, to be fair. Oh, this is from Alice. I've been a bit worried about Alice. Alice I think, had to come off Ciclosporin because of COVID. And I think that's happened to a few people. And obviously the immunosuppressants is holding everything back. So everything's kind of come forward and it can be quite scary. It says, how do you beat the doubt that we're doing the right thing? My head is all over the place. I don't think I doubted that I was doing the right or wrong thing. You get doubts when you've got a doctor telling you you're crazy or stupid or good luck. How do you beat the doubt?
I definitely get the doubt.
Yeah.
I'm very much like the opposite to you, aren't I? I'm quite doubtful. I suppose that's just the nature of going to doctors and asking for help and getting the same thing. And knowing, I suppose you know something's wrong. So if you imagine TSW wasn't a big phenomenon on Instagram, like in your head, you know steroids aren't helping. Everything's being suppressed, so.
Yeah, I think the doubt comes from the fact that you are so poorly. So it's like, okay, I'm doing something to make me better, but I'm so poorly and I'm just getting worse and worse. And aren't I supposed to get better from this? And then you're continuing to get worse and worse and worse. And sometimes like you just crack and you're like, is this worth it? Or is what I'm doing right? Should I be moisturising? Should I be doing this? Should I be doing that? Should I fly to fucking Singapore and get some laser? I don't have any doubt that we're doing the right thing. I don't think we should be using steroids, especially to treat I think mild eczema, moderate eczema. I think they just damage skin cells. I don't think they do anything good. I had this weird thing with TSW where when I was using steroids, my back was always really, really badly affected. I had these kind of like rashes that were kind of like this, but not coin-shaped, but it was just so rashy all of the time. So anytime I would go on holiday and tanned, it would be a patchy tan. So I don't know, people used to call me like a cheetah, or like a leopard, not to be confused with leper. because my tan was always patchy, where it just wouldn't tan over those patches and my back. And then it was like, as soon as I gave up steroids, my back was fine, and it's been pretty much perfect ever since. So I knew that if my body could react like that, then everything else would be okay. And then as soon as you start seeing different things happen and your body changing in a way that you can't explain, like my eyesight got better. And when I went to go and see the opticians, my eyesight had got better, and I could, like, explaining that, like, I use a computer every day, it should be getting worse. And just weird stuff. Yeah. Keep strong. Keep talking to people. Okay. Did TSW have a negative impact on your sex life? I don't think I had sex for a long time. I think I tried a couple of times, because we're all human. I quite like to have sex as well. So, so I always remember, like, because I find B so attractive, like just wanting to have sex all the time, and like, nah, like you just can't. Like, there were times when I would just have to, like, stay still like this, like, just to not be in pain or discomfort, just stay still. There's no way that you can, like, get kinky or, like, I don't know. So yeah, of course it negatively impacts sex. It's not that the person doesn't want to. I'm sure that they do. They just can't. It's not worth it. And me and B would, like, he would kind of sense with me, like, it's not worth it because you'll be itchy after. Like, sometimes it's a joke now. Like, are you going to be itchy after? Blah, blah, blah. So it does, of course, have a negative impact. Did Ciclosporin and Dupixent help your face flare? You look so good prior to the laser treatment. Yeah, so Ciclosporin helped kind of clear my body of TSW to have a break. Dupixent had its own facial flares. It kind of had this weird flushing thing. I didn't like it. I didn't like the side effects. I didn't like how it works. But they did help, to be fair. I have severe eczema. I'm very insecure, especially with dating. I feel really unattractive. Any advice? This one I felt like I feel that. And I understand. I can understand being self-conscious about your eczema. What I want to tell you is that what you see, not everyone else sees. So those people that you're dating, if they're good enough, they won't give a shit. And they won't even notice. Sometimes people just didn't even notice my skin, or especially when I was starting to get better. And just pretend it's not there. Which is harder than it sounds, and that sounds like really bad advice, but if this person's worth it, then they won't care. If they ask questions, answer them honestly and just say you're dealing with something. You are attractive and you still will have beautiful eyes, beautiful mouth, or your features will look the same. It's just your skin is a little bit broken right now. Yeah, the right person won't care. But I haven't tried to date in that situation, so I have got a lot of sympathy for that. I just can't even imagine how hard it is. Don't try and... maybe I would say, if you're conscious about it, maybe explain beforehand if you can, and just say, look, I'm dealing with this, and I just wanted to make you aware. And then there's kind of like the elephant is out of the room. And then if you are having a bad flare, okay, like you've explained and fine, you can just get on with your date. And I hope that they're nice. Jasmine, do you want to answer this one? Any advice for reducing itch?
Ha! I literally itch as you say the word itch.
Itch. Me too. Any advice for reducing the itch?
A cold shower.
Cold showers.
That's a good one.
Ice packs. Antihistamines.
I would say antihistamines. I know a lot of people stop using them, but for desperate times, if you feel like you're going to go into an itching fit, I would even take a small antihistamine.
Yeah, I used a lot of antihistamines, to be fair. You can get addicted to them too, though. Be careful. Reducing the itch. A cool room, which is quite easy in Singapore because everything's aircon. Cotton clothing, loose clothing. If you get sweaty, have a shower straight away. Nothing spicy. Distractions, yes. Get someone to stroke your hair, brush your hair, give you a little massage.
Watch a movie you like.
Yes. Netflix is your friend right now. RuPaul is your friend right now. Watch the whole 12 series of RuPaul.
That's the answer. How to You've
RuPaul.
Got 12 seasons of RuPaul Drag Race to watch.
Okay, after your treatment in Singapore, will you be healed forever? Healed from TSW? Yes, but they did tell me that I needed 6 months worth of treatment, and I would quite like to go home after 3 months, which I'm going to probably do and just see how I get on. If I need to come back, then I will. Healed from TSW, yes. They've said yes. Healed from eczema, no. I think I always have sensitive skin. I think my eczema is wrapped up in contact dermatitis, allergy prone. So I think kind of allergy triggers will always be a thing for me. And I'll just have to manage it differently. The way I'm going to manage it is probably by using the Balmain Skin Salvation balm as a steroid. So if I get a flare up, and kind of learning this body patience where if I do get an allergic reaction that I can't fix it overnight like I used to be able to. It's going to be there for 2 weeks. It's there for a reason. It's my body saying something isn't right. So just learning that body patience, I think. How do you deal with PTSD symptoms? And if so, does this affect your relationship? Yeah, it's a good question. In terms of relationship, well, it wasn't great because I kind of got so bad that me and B have taken a break. I'll talk a bit more about that later. But how do I deal with PTSD symptoms? I've been struggling recently because I get a lot of DMs, and I don't mean to moan about it. I know I do sometimes. But a lot of the DMs are kind of full of pictures of people with TSW. And especially if they're children, I kind of find it quite difficult. Especially because I seem to have this, I don't know if this is true of people that have been through a trauma, where I kind of have this mental block where I'm trying to remember some parts of last year and I just can't remember them. I can't remember it. And so, for example, we filmed I think she might be 18 or 19-year-old girl here, who I'm sure she won't mind me discussing this. And we filmed a bit of her for the documentary. She's getting treated here by the laser, and she is really badly affected by TSW. And when we saw her, she just had her first treatment, so it was all a bit of a shock, and she's in pain, and I can't even imagine being in public when I was that bad. So when we saw her, she seemed like she was out of it, she must have been in so much pain, just out of it, she was on drugs, but obviously she's not. But it's that pain that you can kind of see it in people's eyes. And I said this to Mum and Dad. I was like she just didn't look like she was there. And they were like, "Lou, you looked like that for so long." And I was like, I can't even remember. So I think the mind does weird things, and the mind protects you in some way. In terms of post-traumatic stress disorder. Before I left, anytime I would have a flare, probably didn't help that I was smoking a lot of weed, because if I did flare and I looked in the mirror, I did have a panic attack one night where like it took me back, and I was like, oh my God, like this is happening again. But yeah, I haven't had it too bad over here. There's a lot of time and space to think things through. Any suggestions how to get moisture back into the skin? My daughter's skin is super flaky. Exercise would be the only thing, apart from if you want to do non-moisture treatment. Exercise, sweat it out. I've been doing loads of exercise out here, and I've noticed as me and Jasmine are starting to get better, we're starting to get little pimples everywhere where our hair follicles or the oil production is kind of coming back. So yeah, so that oil production is starting to work again. And I think as you sweat in the heat and the exercise, it kind of can trigger something. As far as that, time. Tips for getting confidence to go out in public whilst having a bad face flare. Hashtag flaking it. I like that. You have to give yourself some badass boss bitch energy, because it's not easy. And oh my God, some of the stares I used to get everywhere. But I didn't let it stop me going out. And I think that's kind of what would set me apart, is that where other people would hide away, I thought, actually, fuck you and fuck this. I'm going to go out. And I wouldn't say it's easy. And I think some parts of the trauma I suffered came from that, is other people's reactions. You just have to think that those people that you care about don't care, and those people that do care, you don't care about. So if someone sees you for a split second, you're never going to see that person again. So who cares? What are they going to think? What's the worst thing that they're going to think? Is that you've got bad skin, or all that girl looks poorly? If that's the worst thing that they're going to think, they probably will feel pitiful or sympathetic towards you. Or they just won't even notice and be in their own world. I think you have to see it from someone else's point of view and what would they think. But again, it's not easy, and just do what you can, take baby steps. Okay, this question is quite important. At any point, did doctors consider your mental health and the impact of how you looked? I was quite lucky to have a good GP at the time, and they really did look after me. And kind of, I know that the main GP there wanted to give me steroids and was probably quite frustrated, but he did listen to what I was doing and why I was doing it. And the nurses there were fantastic. There was a couple of times when I would go in there and they would just look at me and be like, this isn't right. Like, my mum would be with me. And I would kind of break down when I went in there, and I'm not sure why. I think it was a setting. And I would say, this is really hard, and they would say, we can tell this is really hard. And when I went back, when I was a little bit better, my GP was like, I just don't know how you did it. I don't know how you did it. I couldn't do 2 weeks of that, and you did months of it. So, I mean, they always tried to look after me in terms of, I think they knew I was quite well supported with my mum, because she's a counsellor now. They could probably sense that emotionally I was quite well supported. My GP did try and push antidepressants last time I went, or at least put my dose up. I've been on antidepressants now for a long time, and I need to come off of them. I don't need to put them up. So I just said to him, I'm fine. But I think he was trying to correlate my skin reaction to stress levels, whereas it's just TSW. Oh, my addiction to SSRIs will be our prescribed hell too. Is Protopic addictive? I genuinely have trust issues with my dermatologist. Protopic falls under a category or grade 2 of steroids, so it is dangerous and can cause TSW. There's a few people here. Jasmine used Protopic. Sonata used Protopic and her face is quite badly damaged from it. I think those trust issues you're having are for a good reason. I don't think it's good for you. Did you do TSW and moisturiser withdrawal? Did you do it at the same time or did you do moisturiser withdrawal after? I started TSW January last year and did moisturiser withdrawal probably in the March time, so I was still moisturising, and then 3 months later started moisturiser withdrawal. I wish I'd kind of done what Jasmine did and just start moisturiser withdrawal from the start. Okay, if you could change one thing about your journey, what would it be? Can be something tiny. I would have learnt about the clinic in Singapore last year and got sorted and not lose 6 months of my life or a year of my life. Yeah. How has TSW affected your career? I'm afraid to return to work like this after the lockdown. TSW really badly affected my career. I was supposed to start a new job start of last year and got poorly start of last year and couldn't start my new job for 9 months. That job was a data analyst in an NHS hospital close by, which is kind of ironic. Like, you end up ill and then maybe we won't go into that. Yeah, so has it badly affected my career? I don't know. I'm kind of taking a career break, which might be a good thing. I think these things are like sent, not for a reason, but like you go through bad things and it can kind of like something else comes out of it. And I've kind of decided it's time for me to do something more creative, and I don't think I would have realised that having not gone through TSW. And if they're the right company, then they will support you in whatever way that they can. What are your thoughts on diet with TSW? Avoid spicy things, and that's it. I've done all of it. Vegan, this, that, juicing, celery juice. None of it made a bit of difference for me. Would you recommend going for laser treatment in Singapore even if you're not going through TSW? No, I wouldn't. It's a lot of money, and I think that you can explore the root cause of your eczema or other skin condition. Find out what's triggering it, find out what you can do to ease it, use some natural products. Ooh, I like this one. What's been your experience sharing your journey online? It hasn't always been easy. Sharing my journey online helped me to, I don't know why. I don't know if it's because I'm an empath and I needed other people to be empathetic with me who were going through TSW. So it helped me to share, it helped me to, at the time, write down how I was feeling and share that with people that understood and get that response back, and be able to share and not inspire, but I kind of became passionate about awareness of TSW and preventing it happening to other people. And I think that kind of took control. So I kind of had a different focus, and I kind of felt like I had an audience and I had a voice. And those were all the positive things about sharing online. The negative sides would be, sometimes it feels like a full-time job to keep up an Instagram like that. I mean, I don't even have that many followers compared to some people. I don't know how they do it. They need like a PA or something. I feel like I need a PA, but I'm just a bit lazy. So it isn't always easy because it is personal, and I really struggled at the start because TSW is difficult. You don't really know which way to turn. There's all these different things you can do, all of these different recommendations. Moisturise, don't moisturise, do this, don't eat that. And if you kind of put yourself in a position where people can offer that advice all the time, that you get an influx of all of these different opinions, and it can be really difficult to decipher what you want to do and what's important for you, and staying true to you. And also you do get a couple of dickheads online. You get competitive suffering online, which I don't like. I'm sure some people didn't like the fact that I could take the piss out of myself and make a joke out of it at the time. That was my way of coping. And some people, you get like a little bit of jealousy. But I don't know, I feel like I'm too old for that kind of thing. So mostly positive, 5% negative, 95% good. So yeah, it's been great. The feedback I've had has just been amazing. The community is amazing on Instagram, and I hope that I've kind of been part of shaping that, especially for like other people coming into it now. I don't like Facebook groups. The TSW Facebook groups, I don't like them. I came out of them pretty quick. That's because if you've suffered from depression, like I had depression when I was 21, you kind of learn what's good for you and what isn't. And I felt like it was a bit of a rabbit hole of negativity and suffering. We're all suffering. I was really suffering, but if I kind of let my brain fall into that kind of portal of like suffering, and I just knew it wasn't right for me, and I found it to be a lot more positive on Instagram. The one thing that wasn't easy is that Brandon doesn't like social media, and I think that's kind of the same for a lot of tattoo artists. That kind of culture, don't like it, don't get it. So I would say we've probably had quite a few arguments about social media, to be fair, and me using my phone a lot. What are some things you learned from trauma, and how is your significant other during TSW? I've talked about B. I learned that I wasn't scared of anything and wouldn't be scared of anything in the future, especially health-wise. I kind of feel like I conquered that, like I could conquer anything. I don't really feel scared of many things now, whereas before I always had such bad anxiety all the time. But now it's like in my head I'm like, well, you went through TSW, you can do this, and that's kind of like my mantra now, and that's just how my brain works. So I learned that I'm stronger than I think. I learned that that you need people when you go through trauma like that. So I learned who my real friends are, who the real people are around me, the ones that care, the ones that really loved me. What else did I learn? I learned my coping mechanisms. I learned the bad sides of me and the good sides of me, all wrapped into one. Okay, says, I'm new to TSW, what should I do and what should I avoid doing? And which month was the worst for you? The worst month for me was months 3 and 4. I think that might be quite similar in most people. It kind of like you get to this like steep uphill of TSW. Everything's getting worse and worse and worse. And like month 3 and 4 for me was when I kind of like hit that peak and then came back down. That is when I started moisturiser withdrawal as well. For some people that takes 6 months to get to that peak and back down, and some a little bit sooner. Don't moisturise if you can. Stop moisturising. What is everything you were diagnosed with by doctors over time? I was diagnosed with dermatitis and eczema, severe eczema. How long did you use steroids? Since I was 5, so 23 years. Okay, has your depression ever caused you to feel suicidal? Yes, I could probably count on 2 hands the amount of times I considered ending my life. Bless you.
Sorry.
I considered ending my life when I was poorly, which is a bit scary. I'm such a pussy that I just thought I'd just take loads of tablets and just do it and get it over and done with. Yeah, but I didn't. Things did get better, I promise. How were you able to tell the difference between red skin syndrome and fungal infection? Fungal infection is kind of like coin-shaped most of the time, and a few coin-shaped. It's always a ring and it's always a clearer colour in the middle. How long do you have to wait between your laser sessions? We have a laser session once a week. What is your top tip for finding the cause of your eczema? Or maybe accepting there's nothing more you can do. Top tip is get allergy testing, so skin prick allergy testing and blood allergy testing. Any advice for coping with hair loss? I just leave my scalp alone, but gosh, it's a nightmare. This is one I do want to answer. My scalp was really bad with TSW. Like I had these kind of like flakes that were huge and it was just completely covered. And I knew something wasn't right because my hair was falling out in clumps. So I've got a bit here that was like completely bald and it's growing back now. So one of my best friends is a hairdresser and I knew something wasn't right. So I asked her to come over and have a look at it. And she said that because the scalps were kind of suffocating the hair follicles underneath, that I needed to get rid of them so that all the hair follicles wouldn't die. And then my hair would stop falling out. So she, bless her, she came over when I was really poorly and gave me like a head scalp like rub with this kind of like, I think it was like a salty mix, and it was a bit like an exfoliator for the scalp and kind of got rid of those flakes that were kind of like hardened on, and then from there things just got better with my scalp and I don't think I had much more hair loss after that. What body wash do you use in the shower? I used a Balmain's body wash. 2 questions. If you were ever to use steroids again, even just a small amount, would that put you back? Some people, yeah, some people use, I think that scale of steroids, so the 7 different grades, I just wouldn't ever touch steroids again. Yeah, let's leave it at that.
Yeah.
I feel like I whizzed through those quite quickly, ish, even though there were like a lot of questions, and hopefully I answered what you need to. If there's something that you really need to know, please let me know. Maybe I'll get Jasmine to pop like a couple of images or videos of me when I was really poorly. There was a video recently like where I'm crying into the camera, which I watched. It had gone up on some medical site, and it kind of made me cringe to watch it because I was like, God, like 1, why was I doing that? And 2, like I have kind of forgotten how bad it got. kind of like in this like dreamy kind of state where my skin's really good and like I'm just enjoying it for what it is. And I think that everyone should do that, even if it's just a break. Just enjoy those moments where it's good. But I'm also acutely aware of everyone else that's suffering online. And yeah, so thank you for tuning in. And we'll think of something for next episode because we're in lockdown and there's not much we can do.
No reflection. I'm so sweaty.
Woohoo!